Dr. Tom Huebner back with our patient Rory, who had his surgery 12 days ago now, and he's here for suture removal. And Rory, we're so happy to see you again, and we're happy to remove your sutures today, give you a little more comfort. How's your experience been, especially immediately post-operatively, and then for the last couple weeks?
Very good for the most part, just sitting around, icing up the head, keeping it elevated, literally no pain. Like tiny bit of swelling day one that went down pretty much immediately after icing.
Awesome. And then taking care of it post-operatively with the instructions you're given and kind of what we went over, no problem, right?
No problem.
No problem at all. So you can see Rory's been wearing a cover just to kind of keep things, relatively unexposed. But if you want to remove that, Rory, you can show everybody kind of what we're talking about at the 2-week post-operative period. Now, you can see here, essentially all of his scabbing in the front has fallen off. He still has some residual scabbing in the back, but that'll continue to fall off in the course of the next week or so, at which point he can go back to towel drying. And you can see even at this stage we shaved a little bit away where the suture line was, and that's really what you're seeing there, that white area, but otherwise pretty well covered up at this point even. And we're going to show you the scar in a second, but we're really excited about the growth Rory has already, although some of these hairs that grow in initially, I don't know if you can kind of see them there, you can expect that they'll fall out and that they'll come back again around 3 or 4 months. But we're really excited about the coverage we're able to get for Rory, and excited to follow up in 3 or 4 months to make sure that's growing in. So now we're going to take a look at the suture line one last time around here. Grab a comb. And he's just had his sutures out, so there might be a little bit of oozing from some of the sites, but kind of see there's a thin line, even hard to see with the camera even this close. Still has some scabbing around the suture line, which eventually will go away. He can continue to wash that. But really, really excited about how it's turned out. You can tell Roy's really followed the post-operative instructions very well. Coming up here, just in the area of scabbing, just the thinnest little line. Same thing around here. A little bit red, but the redness will go away. I'm telling you, it's even hard to see with the camera. Really better to appreciate with the naked eye, but hopefully no one will really ever be able to appreciate it with the naked eye, and that's our goal when we bring the edges of the wound back together. So we are really excited about the result Rory has gotten so far. Another look at it, just that thin line. And we'll be following up with Rory in the next few months to see his growth, and really looking forward to seeing what happens. And any last words of advice for people looking to get this done, or maybe a little bit worried about the procedure itself or the pain or the post-operative period?
I would say go for it, man. For me, there was no pain.
Yeah. And that was awesome. We called you the next day and made sure you were doing okay, and it was awesome when you told me, very little pain at all, although we did provide medications in case you needed it to get through. But really happy for you, Rory, and we'll be checking in on you in a few months.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.